Sarah, thank you so much for your time. Really appreciate it. Look, we'll take a little bit of a different view of professional development here. As an educationalist yourself and as an education provider, what makes a good learning opportunity?
I think it's really important to understand the needs of the people who you're providing the learning opportunity for. I think some of our experiences has been sometimes we might think it's a really good opportunity, but unless the group that you're looking to engage with thinks it is also, then you're not going to get the level of attendance. And trying to make it, when you're developing a session and promoting a session, trying to make it so that people really understand what it means to them or how it's going to help them in some way, or in their practice or in their professional development, I suppose.
So for you, planning for learning, you're really trying to connect with the needs of the audience and thinking about the context of being a GP?
Yeah, context of being a GP, but sometimes it's about trying to provide that wider context and how the work links up to other work that's happening in the sector maybe, or clinical best practice guidelines, or new developing areas of interest, I suppose. Sometimes it is about trying to promote and push new ideas of thinking, but in that way you really have to sell it as in this is really meaningful because, or this is how it links to the things that you're doing, or how it will support you to do this in a better way.
Yeah, and I think those kind of questions are really good, and they lead me to my next question, which is really about the power of reflecting on learning. And so what kind of things can GPs do to really embed learning that they're exposed to?
Well, I think if they can try it as close to when they learned it as useful, in terms of if they have leaving the session, they can clearly think about when they would likely put that into practice, or I think there's that opportunity to think about it at the time, understand how it connects to the work that you're doing, or the future work that might come in the door, or so that you can make that connection straight away, but also the opportunity to practice it as soon as possible, I think, after whatever learning opportunity that you've had. Otherwise it's 6 months down the track when that person comes in, they might remember that they went to something but can't quite remember what the details were, but if they can access it, say it's linked to something that they can easily access and refresh their thinking on it, then I think that would be really useful as well.
Yeah, I think that's a really powerful take-home message. Thinking about your learning, maybe making a couple of notes, trying it out as soon as you can, and perhaps sharing it with others. In your experience as a learner then, how important it is for you to share what you've learnt with others as a way of in embedding learning?
Right, I grew up in nursing, and so it was always see one, do one, teach one. And I think that probably still stands true, actually. It's about that repetition within the learning process, but also to really connect with the content that you learned. Yes, doing it, but then trying to articulate in a way that makes sense to the other person means that you've really meaningfully connected with the learning as well. So, yeah, I think it probably does make sense.
I think that's a good message to remind the profession about. Sarah, thank you very much for your time.
Cool.
Appreciate it.